Can autism mask the symptoms of bipolar disorder? Can autism mask the symptoms of bipolar disorder? This is a question that many people may wonder about, especially when considering the complexities of mental health. Autism spectrum disorder and bipolar disorder can share a variety of symptoms, making it tricky to tell them apart. For instance, both conditions can involve elevated moods, irritability, and impulsivity. An autistic person might display high energy levels, talk quickly about their interests, or engage in repetitive behaviors. These actions can resemble the manic symptoms of bipolar disorder, like increased activity or pressured speech. However, in autism, these behaviors are often consistent and long-lasting, rather than occurring in episodes. Bipolar disorder is characterized by distinct mood episodes that can be manic, hypomanic, or depressive. These episodes typically appear suddenly and last for a specific duration. In contrast, traits associated with autism are usually stable and present throughout a person's life. For example, a sudden drop in sleep, increased impulsivity, or notable mood changes might indicate a manic episode layered on top of autism, rather than just typical autistic traits. Diagnosing bipolar disorder can be particularly challenging in autistic individuals. Autism is often diagnosed in early childhood, while bipolar disorder usually emerges in adolescence or early adulthood. This timing can lead to bipolar symptoms being overlooked or misattributed to autism. Clinicians need to carefully assess the timing and intensity of mood changes to avoid confusion. It is also essential to understand that some behaviors that appear to be bipolar symptoms may actually be expressions of autism. For example, repetitive speech or intense focus on special interests can be common in autism. True bipolar episodes, however, often include sudden mood shifts, increased risk-taking, and changes in sleep patterns that differ from a person's baseline autistic behaviors. To differentiate between these conditions, ongoing observation by caregivers and clinicians is vital. Keeping detailed notes on mood changes, sleep patterns, and behaviors can help identify whether someone is experiencing bipolar episodes or simply exhibiting autistic traits. Accurate diagnosis is crucial because treatments for bipolar disorder, such as mood stabilizers and antipsychotics, can have significant side effects. This is particularly important for autistic individuals who may face communication challenges. In summary, autism can indeed mask the symptoms of bipolar disorder due to overlapping behaviors and the stable nature of autistic traits. Distinguishing between the two requires careful attention to the onset, duration, and patterns of symptoms. Identifying episodic mood changes that are not typical for autism alone is key to ensuring appropriate diagnosis and treatment for those who may experience both conditions.